My name is Ginnie Lin. My title is a Public Health Analyst, and my agency is the Health Resources and Services Administration. The bulk of what my division works with is the Rural Communities Opioid Response Program, which is a little bit of a misnomer because our work certainly isn't limited to just opioid response. In many ways, we've expanded to respond to the needs that we're seeing in not just opioid response, but overdose response, substance use disorder, many different types of substances, and honestly, behavioral health at large. We give grants and funding to rural communities across the United States. Our division is full of really motivated people that come from diverse backgrounds, many of who also did Peace Corps like me, and also come from kind of that health in a rural setting background. Just within my agency alone, there are statisticians, doctors, budget analysts, policy researchers, even communications team that are all trying and are all needed to carry out the mission of our agency. Before the federal government, I worked at a nonprofit and I was working with a budget of around $50,000 over the span of 6 months. At the end of 6 months, that grant ended. When I joined the federal government, the family of programs that I work with, since its inception, has invested over $500 million in rural communities. That is a huge difference of magnitude in terms of budget and in many ways change. I think the best part and most amazing part of my job is that I get to talk to community members who are really passionate about the work that they do every single day. Literally every single day of my job, I get to talk to people who are really pushing the needle in terms of overdose response, in terms of health inequity, and who truly care about their often small communities. Just among my peers, I think the federal government is competing in terms of recruitment with a lot of big names, like tech, for example, or it's tempting to get a very large paycheck, or it's tempting to work with a very, potentially small but well-known nonprofit that's very agile. Even within the federal government, there are innovative and new programs that are forming to address some of America's biggest issues. If you're looking to affect change, I think that this is the best place to do it, and the place that has the most capacity for large-scale change. There's really something for everyone.